Good to see you again, Dr. Brian McGowan. Thanks for talking to OnSearch. I was at a meeting recently where there were a lot of presentations about how students and residents were studying and why they were studying. And it seemed they were studying mostly to pass tests. And it seemed that what they were studying, what they were self-teaching with on these on their rotations, are resources which are quick reference pocket handbooks, but largely Google and Wikipedia. And the educators at this conference were cringing when they learned that students were using Wikipedia to learn medicine. So tell me about, in your view, the advantages of a head full of answers versus a handful of internet.
I like the way you said that. I think about this a lot, right? I find myself right in the middle. So I'm 42 years old, graduated from medical school in 2001, but I spent the last 13, 14 years studying how people learn. So the community that I'm interested in includes the 28-year-olds, the 25-year-olds, the 68-year-olds, and the 65-year-olds. So I'm interested in the contrasting styles across all of this. I actually presented last week. I was out in San Francisco on this topic, on generational differences in learning, and my co-presenter was mid-60s, 30, 40-year-old profession, former dean of X, Y, and Z. And my guess is he would be one of the people who was cringing in your presentation. So let's see if we can build the pros and cons of either side of that argument. And I think what we'll find at the end is we're going to build a continuum here, right? So for the better part of the history of medicine, the most respected clinicians have been, especially within the profession, have been those clinicians who have the greatest amount of information at their fingertips, figuratively, but in their head, literally. And so we all knew who we can go to with a question, and that person had the answer. And then there were always the one or two colleagues that we had who not only had the answer, but could give us the citation off the top of their head. Oh, that was Mather 85 in circulation. You want to look at the second figure. Like, whoa, right? And that's such a striking moment when someone has an answer, they deliver it to you confidently, and they can actually cite it. So you feel like there's some anchor to what where they're pulling that information from. And if you do that enough, and over decades and decades, that became the gold standard, the Hall of Fame of what a clinical a professional identity was all about. Now, obviously, when they applied it, we wanted them to have the right interaction with the patients, and there's other things that go into being a world-class clinician. But as far as the profession of being a doctor, it's those folks that had the information available. And we operated for the better part of the last 100+ years as if any one of those really, really smart docs that crossed our path actually had all the information, right? And when my father-in-law graduated in 1963 or 64 from Jefferson Medical School, founded the first endocrinology practice, there was nobody in Lebanon County, Pennsylvania, there was nobody who knew more about endocrinology and diabetes than Dr. Murray Grosky. He was one of those guys. You might have been able to know a lot about endocrinology and diabetes back then, but at this point, there is mountains of evidence that suggests that no one individual can capture all of the knowledge that they would need, even in a day of practice, right? So that's a pretty big chip in the armor of professional identity. And it's something that's really emerged over the last 10 or 15 years, that maybe the folks who have the answers, or we believe they have the answers, and the folks that can cite the reference, maybe that's a fault, that's an illusion of some sort. And and they have confidence, and maybe we have confidence in their answers, that is not providing us all the perspective we need. So on one hand, having a head full of knowledge is probably no longer valid, that no one can capture all that information. So we know you have to outsource some of that knowledge archive to some other form of information management. And whether that's the journals or the textbooks, or increasingly whether that's the pocket guides, the point of care education, or God forbid Wikipedia, if you just believe that Chris can't know it all, then that opens up a Pandora's box of what it means. Now, on the flip side of the situation you presented, you have what are often painted as this new generation of clinicians who have a pocket full of internet. Wow. Now, it's usually said in some disparaging way, right? So it's painting a us versus them, or them versus them scenario. And you have individuals who will say in a moment of ridiculous confidence, I don't need to learn it because I can go look it up. Okay. Now, these folks are confusing access to knowledge with mastery, right? And the ability to find information versus the ability to understand it, synthesize it, and apply it. So the gold standard of 1960s, 1970s medicine had a lot of information, but they also had a lot of mastery and experience. And the information that was circulating in their head was filtered through their experience, and it gave them the ability to apply that knowledge in a different way. 26-year-old, if we're going to paint with this generational brush, a 26-year-old resident can find information, or believes that she can find information. And if the question's posed in a literal enough way, that maybe she could find the exact answer to the question that she really needs to ask. But the ability to pose the perfect question so you can find the right information is a barrier that can't be overlooked. Where are they finding the information is a barrier that can't be overlooked. What's the validity of the information? The credibility of the information they're finding is a barrier that can't be overlooked. So the head full of knowledge guy doesn't actually know everything that needs to be known. And the pocket full of internet young clinician better understands that access to information does not mean mastery. It does not mean the ability to apply it. And so neither of them is where we need to go as a profession. So we need to find a balance, and it's not 100 0, and it's not 0 100. I don't know if it's 50-50. I think maybe I'm enough of a traditionalist to think that it's probably closer to 70 head full of knowledge, 30 pocket full of internet. I think that's probably where I'd go. But I need someone to convince me that the literature base is accurate and credible. And that means peer review, publications, all of those things that we've relied on in our training. I need to know that that's actually accurate, and I've got increasing doubts about that. And then I certainly need to know about the credibility, the timeliness, and the risks involved with these new sources of information. Now, the new sources of information, we're talking about these things have existed for 15 years versus the published literature that's existed for 200 to 300 years. So we have a lot to learn about how to structure information, validate information. We're now applying peer review to information in a way that's never happened before. And there's an unbelievably valuable science around crowdsourcing, expert crowdsourcing, that you're going to find is increasingly important in the decisions that you're making in the OR.
You told me something surprising the other day about the proficiency of this generation in finding best answers and overconfidence in that.
Yeah, not to give more bullets in the chamber of those who are cringing at your recent meeting, but there is a pretty well established literature base demonstrating that the generational differences, while they may be real in terms of preferences, they are very much an illusion in terms of competence. So if you ask 100 college kids whether they believe that they can go on Google or Wikipedia and find the best answer, their competence, their self-perception is going to be their self-perceived competence is going to be very high. If you actually then test the various answers that they found, they perform no better, and in many cases worse, than a generation or two removed. So being able to grab that smartphone, know how to use the buttons, and navigate through apps and mobile sites is very different than having the critical thinking skills to understand that Google's page rank may not be the right barrier, or it may not be the right determinant of what's important or not important in my practice. Right. So more recently, we've seen some examples of where this pocket full of internet supportive structure may take us. So there are profession or specialty specific search engines. Okay. So instead of getting 4 million returns on bypass effects, we can get through somebody's rubric a more appropriate 150 returns on bypass effects. We have social learning communities that are now being supported by medical professional societies. And increasingly, we have electronic health records that actually allow the teams to interact in the middle of practice. So each of these is providing a critical science underneath the pocket of internet side of the equation. There's not much incentive for the medical industrial complex that supported the head full of knowledge side of the equation to do much research about how to make their models better, right?
or to do the research to find that they're being more obsolete.
Yeah, and it's really interesting. When I wrote Social QI a few years ago, it was just at the dawn of a lot of this peer review groundswell. And both in the UK and in the United States, there were petitions being signed by tens of thousands of clinicians demanding that publishers change their copyright restrictions on their own work, and funding agencies changing their expectations of publication. So if we're going to give you an R01 grant, or in the UK, if we're going to give you a grant, it's our expectation that you publish all of your findings in open access journals. So we're talking about 5 years of this actually becoming nearly mainstream to streamline the way information gets into public access. Now, for the head full of knowledge, you go to a journal to find a piece of information. For the pocket full of internet, it becomes a lot more viable when all of that information is publicly available, and there's not these 6-week embargoes or these 6-month-long closed access, restricted access limitations that make it impossible. You can't go to the web and find Porter's publication from 2 weeks ago if he published in a closed access article. in a closed access journal. So maybe we're on the pocketful internet. Maybe we're in the third inning. On the head full of knowledge, we're at the bottom of the ninth, but we're facing about a 25-run deficit.
Very nice. Well put. Last words?
If someone tells you that they know everything they need to know, don't trust them. And if someone tells you that they can look up anything they need to look up, don't trust them.
Great. Thanks, Dr. Brian McGowan.
Thanks, Chris.
Good to see you. Well, good. Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.